Myself, Dr. Arindam Chatterjee. I am a practicing physician in Salt Lake area in Kolkata. Now, today I will discuss about the topic that is the understanding hypertension. Our today's discussion will be on what the blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer time, and if it is left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is called hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As the people gets older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure, one or more closely related family members with hypertension increases the person's risk of developing the condition. So excess salt intake is also known as a causative factor to raise the blood pressure. Not eating enough foods with potassium can increase the blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increase fats throughout the body and make the heart work harder to push blood throughout the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and it causes the further rise to high blood pressure. And another one is stress. Reacting to stress in unhealthy ways or not managing the stress also increases the blood pressure. So moving on, hypertension does not have any obvious signs and symptoms. That is why it's often called as silent killer. It puts the people at risk for several diseases like cardiovascular problems to kidney failure and stroke and even eye damage and also blindness. Hence, early and accurate diagnosis is very important in the management of the hypertension. Measuring the blood pressure is the only way to know whether the person is having high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, nausea, and vomiting. If the person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument that is called sphygmomanometer. A blood pressure is recorded in two numbers, diastolic and systolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also read as 120 over 80 mm of Hg. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, means the pressure in the blood vessels when the heart rests in between beats. If blood pressure level is more than 140 by 90 millimeter of mercury, then the person have hypertension. If the person have BP higher than this, then he or she might be at risk of developing serious heart diseases. This risk can be prevented or reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking, and regular blood pressure monitoring, stress management, and adherence to medicines. If the blood pressure is successfully controlled with the lifestyle modification, then it might avoid the delay or reduce the need for medication. So let's take a look at these strategies one by one. Number one, that is the regular exercise or physical activity. Exercise can be a drug-free approach to lower the blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with this less effort. If the heart has to work less to pump and force on the blood vessel to that will decrease and lowers the blood pressure. In other case, as we are all aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, that is less than 120 by 80 millimeter of mercury, then the exercise can help prevent it from rising as you age. Regular exercise also can help by maintaining a healthy weight, which in my opinion is an important way to control blood pressure. One should aim at least 30 minutes of aerobic activity most days of the week. High blood pressure can be reduced by doing the regular structured exercise such as brisk walking, jogging, swimming, etc. Next comes the number two, that is the healthy diet. Diet also plays an important role in the controlling blood pressure. A diet with high intake of vegetables, fruits, and the whole grains is recommended for the hypertensive patients. For lowering blood pressure or preventing the hypertension through dietary intervention, can one adopt a dietary pattern such as DASH diet or a Mediterranean diet, eating less amount of saturated fat and total fat, getting plenty of potassium, and limiting the amount of the sodium in the diet and limiting the alcohol consumption. So DASH stands for the dietary approach to stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low-fat dairy products, and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 mm of Hg if having high blood pressure. Next is the reduced sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 mm of Hg if you have high blood pressure. So to decrease the sodium in your diet, you can consider tips like read food labels if possible, choose the low sodium alternatives of the foods and beverages you normally buy, eat fewer processed foods, and don't add salt. Just one label teaspoon of salt has 2,300 milligram of sodium. Avoid adding salt to food and use herbs and spices to add the flavor to your food. Next is the quit smoking. Stopping smoking helps your blood pressure return to normal. So quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Next is the regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for the patients to visit doctors and check up their blood pressure. Hence, most often I advise patients for self-monitoring of their BP levels. Self-monitoring helps the person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get more complete picture of person's blood pressure readings at different times. So further helps us in the better prediction of the cardiovascular morbidity and mortality rather than single routine and blood pressure measures that occur during a clinical visit. Next is the stress management. By learning how to relax and manage stress can improve the emotional and physical health and lower the blood pressure. So stress management techniques include exercising, listening to music, and focusing on something calm or peaceful, and meditating. Next is the adherence to medicine. So a medicine is lower blood pressure may be recommended by doctor if your blood pressure is persistently high, usually at the level of more than 140/90 millimeter of mercury. So adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy lifestyle. Adapting a healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping the blood pressure in the normal range is very important in preventing the cardiovascular complications. It is very much possible to maintain the normal blood pressure levels with regular monitoring and preventive care. Thank you.